Asthma medical management. Immediate intervention may be necessary, because continuing and progressive dyspnea leads to increased anxiety, aggravating the situation. Short-acting beta agonists, albuterol, Ventolin. Corticosteroids, prednisone, beclomethasone for short-term therapy. Anticholinergic agents, Atrovent. Mast cell inhibitors, Cromolyn. Leukotriene modifiers, Montelukast, Singulair. Inhaled steroids, Advair, Pulmicort, Asthmacort. Theophylline. Peak flow monitoring. Peak flow meters. Peak flow meters measure the highest airflow during a forced expiration. Daily peak flow monitoring. This is recommended for patients who meet one or more of the following criteria: have moderate or severe persistent asthma, have poor perception of changes in airflow or worsening symptoms, have unexplained response to environmental or occupational exposures, or at the discretion of the clinician or patient. Function: if peak flow monitoring is used, it helps measure asthma severity and, when added to symptom monitoring, indicates the current degree of asthma control. Nursing management. Nursing diagnosis: ineffective airway clearance related to airway spasm, secretion retention, amount of mucus. Ineffective breathing pattern related to spasm of the airway, respiratory muscle fatigue. Impaired gas exchange related to bronchospasm, damage to the alveoli. Activity intolerance related to imbalance of oxygen supplied to the needs. Nursing interventions. Assess history, obtain a history of allergic reactions to medications before administering medications. Assess respiratory status. Assess the patient's respiratory status by monitoring the severity of symptoms, breath sounds, peak OW, pulse oximetry, and vital signs. Assess medications. Identify medications that the patient is currently taking. Administer medications as prescribed and monitor the patient's responses to those medications. Medications may include an antibiotic if the patient has an underlying respiratory infection. Pharmacologic therapy. Administer medications as prescribed and monitor patients' responses to medications. Fluid therapy. Administer fluids if the patient is dehydrated. Assess respiratory status every hour during acute phase, lung sounds, respiratory rate and depth, presence and severity of wheezing, breathing pattern, use of accessory muscles. Assist patient to assume to comfortable position, i.e. elevate head of bed, have client lean on over bed table or sit on the edge of bed. Keep environmental pollution to a minimum according to individual situation. Encourage and assist abdominal and pursed, lip breathing exercises. Increase fluid intake to 3,000 milliliters day within cardiac tolerance. Provide warm liquids and recommend intake of fluids between meals, instead of during meals. Administer medications as indicated. Monitor side effects of bronchodilator, tremors, tachycardia. Provide supplemental humidification, e.g., neutralizer in respiratory treatments. Monitor ABGs, pulse oximetry, chest X-ray. Assist parents in eliminating allergens or other stimuli that trigger attack. Meal planning to eliminate allergic food. Removal of pets. Modification of environment, allergy-proof, home especially no smoking in home. Avoid extremes of environmental temperature. Thank you. Like and subscribe.